Hello at Medical Sciences. In this session, we are going to take you through what we call African trypanosomiasis. You can call it sleeping sickness. So this African trypanosomiasis is a disease condition caused by the parasites. We can call them hemoparasites under genus Trypanosoma. And we are going to see this disease, which we are calling African trypanosomiasis, known as sleeping sickness, is caused by two major types of hemoparasites, and that is Trypanosoma brucei rhodesiense and Trypanosoma brucei gambiense. Those are the two types of trypanosoma which can cause African trypanosomiasis. There is also what we call Trypanosoma brucei complex, which infects animals. So we are seeing these two are the ones which are of medical importance. That is Trypanosoma brucei rhodesiense and Trypanosoma brucei gambiense. This one is a Gambian type, then this one is the Rhodesian type of trypanosomiasis. So this trypanosomiasis caused by the Rhodesian species, it is majorly located in East Africa. So we find it majorly in East Africa, as we know that this type of African trypanosomiasis is found in sub-Saharan Africa. So part of East Africa is, we find there the one caused by Trypanosoma brucei rhodesiense, whereas in West Africa, that is West and Central Africa, here we see it is caused by Gambian trypanosoma, called Trypanosoma brucei gambiense. It's the one that causes sleeping sickness in West and Central Africa. Whereas in East Africa and some part of South Africa, we find there Rhodesian trypanosomiasis. And the infection type of rhodesiense is acute, meaning the onset is fast. So after a bite by a fly known as Glossina, the infection spreads faster. So the onset is fast, whereas in Gambian, we see it is chronic. The type of infection is chronic, meaning it is slow onset. This one takes days to weeks to months, whereas this one takes months to years to develop into what we call late period. And another thing, we are saying, what is the vector? We are seeing these trypanosoma parasites are transmitted by a vector known as sassafras. And this type of sassafras belongs to what we call Glossina. So Glossina species are the one that transport or transmit or acting as the vector of the trypanosoma. And this Glossina, part of the Glossina, among the Glossina species which are responsible for rhodesiense include Glossina monstans. We have Glossina monstans. We have Glossina pallideps. Then we have also Glossina swinatoni. So these are the three species of Glossina, what we are calling sassafras, that transmits this African type, which we call Trypanosoma brucei rhodesiense, responsible for causing sleeping sickness. whereas here the vector. So these three, we give them a common name, and we call these East African vectors to be what we call savanna. You can call them savanna or woodland. So the reservoir hosts of this type of rhodesiense are the game park animals. So we see the game park animals. Whereas the Glossina in Gambiense, they are known as riverine. We call them riverine or lakeside types. And they include Glossina palliparis, we have Glossina tachinoid, Glossina tachinoidis, then we have also Glossina fuscipes. So these are the three types of Glossina species which are known as riverine or lakeside, responsible for transmitting Trypanosoma brucei gambiense. Whereas we have seen for the East African, we can call them savanna or woodland. And we have seen the reservoir hosts. The common reservoir hosts being can be the lions, the giraffes, and other like the elephants, which are found in the game park. Whereas the reservoir host for Gambiense, they are majorly humans. The humans are the reservoir hosts, whereas the reservoir hosts for the East African type is the game park animals. So these are some of the differences we can give between Trypanosoma brucei rhodesiense and the Gambiense. So after seeing the introductory part and the different types, we have seen the location where they are located. We have seen the type of infection whereby this is acute, this is chronic. Then we have seen the Glossina species which are responsible for their transmission. So after doing that, what is the mode of transmission? The first mode of transmission is through the bite. The bite from the infective Glossina species. So if the Glossina species is infective with metacyclic trypomastigotes, it is able to cause this. Another way can be blood transfusion. And this blood transfusion, it occurs when you're giving fresh blood to the patient. And also it can happen by transplacental, whereby the baby, or what we call the fetus inside the mother, can contract this via the placenta route. So these are the major three routes where we can acquire this sleeping sickness. And remember, we have seen these rhodesiense and Gambiense causing sleeping sickness in humans, but they cause Nagana in animals. So in animals, we call it Nagana. In the human, it is sleeping sickness, whereby in animals, we call it Nagana. So you have to note that. So after looking at the mode of transmission, now we want to see the life cycle. And the life cycle begins when an infective Glossina fly. This Glossina fly contains what we call short metacyclic trypomastigotes. So when the salivary gland of this Glossina fly is containing the infective stage, which is short metacyclic trypomastigotes, when they are inoculated at the site of bite, these trypomastigotes, so if it injects a short cylinder trypomastigote at the site of inoculation, they do multiply. They multiply by binary fission. It was injected when it was 1. Then it undergoes multiplication to form what we call long, slender trypomastigotes. Trypomastigotes. So when they are being inoculated by the Glossina fly, when it is taking a blood meal, it injects short metacyclic trypomastigotes from its salivary glands. So the mode of transmission, we call it salivarian. This is salivarian mode of transmission. Why? Because the metacyclic trypomastigotes are coming from the salivary glands. So when they reach at the site of inoculation, they undergo multiplication by the process known as binary fission. And after multiplying, they continue multiplying, then they go into what we call body tissues. They do not enter body cells, but they multiply in the body tissues. So they continue multiplying, whereby these trypomastigotes enter into what we call blood circulation. I'm assuming this blood vessel is inside this man. So as they are multiplying, we find them within these trypomastigotes. We find them into blood, and within blood, these trypomastigotes continue to multiply by binary fission. So if we have one here, and remember they do not enter into red cells, they are found in the tissue space, or what we call the tissue fluid, but not inside the cells. So if we have this one can multiply by binary fission, we get more two trypomastigotes, and this one also multiplies by binary fission, we get more two trypomastigotes. So this multiplication is what we are calling binary fission within blood. So we are saying in the first 1 week, there is multiplication at the site of inoculation. And when this happens within 1 week, there is what we call manifestation of chancre. There is chancre formation. And this chancre is due to the multiplication of the trypomastigote at the inoculation site. This one appears within 1 week after the infection. And we said this, they continue to multiply within blood by binary fission, and within the second week, they are in the blood. So these ones can even go ahead and invade into the lymph nodes of the body. And within the lymph nodes, when they reach there, they continue to multiply. That is the trypomastigotes. They continue multiplying by binary fission to increase in number, and this one leads into what we call lymphadenopathy. Lymphadenopathy, whereby it will involve swelling of the lymph nodes. If it is Gambiense, it is due to the swelling of the posterior lymph nodes, that is in the neck region. So you find someone with swelling in the neck, in the posterior cervical region. That is due to Gambiense. And this one is what we call winter bottom side. Winter bottom side, which involves swelling of the posterior glands within the neck region, is what we call the winter bottom sign, and is due to Trypanosoma gambiense, which we call West African Trypanosomiasis. We see what we call winter bottom sign. Then lymphadenopathy is also seen. As we have seen the cervical region, we can see it submandibular, we can see swelling of the lymph nodes within the armpits, and even at the elbow and then the groin region. So as they continue, that is in a secondary phase. Then from the lymph nodes, these trypomastigotes continue to migrate into the central nervous system. This is the spinal cord, and this is the brain. So we have the brain and the spinal cord. So These trypomastigotes have ability to cross the central nervous system, or what we call the blood-brain barrier. And when they cross, we find these trypomastigotes within the central nervous system. They can invade even within the brain. And there they continue to multiply by binary fission, whereby when you have one, gives two, when you have another one, gives two, and we end up what we are calling central nervous effects, such as this person might end up with confusion, sluggish speech, and any other form of effect within the central nervous system. So this is the life cycle in man, and it started by inoculation, whereby we inoculate the metacyclic trypomastigotes from infective Glossina fly by mode known as salivarian. Then the second was seeing multiplication of the trypomastigotes at the site of inoculation, causing formation of chancre. Chancre, this is a fluid-filled nodule which is red in color, and it appears 1 week. Then the third, we see it multiplying within the blood. Then the fourth, the trypomastigotes continue to multiply in the lymph nodes. And the fifth is multiplication within the central nervous system. And this life cycle continues when the Glossina fly is taking a blood meal from this infected person. So when it is taking blood meal, this is the skin of this man. So when it is taking up this blood meal, remember it contains the trypomastigotes. So it takes up these trypomastigotes into its midgut. So we see the trypomastigotes being taken into the midgut. So these ones are in the midgut of the Glossina. And when they reach in the midgut, they continue to multiply by binary fission, whereby 1 gives 2. These are the trypomastigotes. Another trypomastigote comes in. That is what we are calling binary fission. Remember, these trypomastigotes have the flagella. So in the midgut of the Glossina, we see multiplication by binary fission. And after increasing in number, they move into the hindgut and come and migrate to the salivary gland. And as they are migrating to the salivary gland, these trypomastigotes transform into what we call the epimastigote. So if this is the form, this is the nucleus, we see the epimastigote coming in. So these trypomastigotes give rise to what we call the epimastigote. And these epimastigotes enter into the salivary gland. So this is what we are calling the salivary gland of the Glossina. So when these epimastigotes reach in the salivary gland, they transform back into what we call the trypomastigote, metacyclic trypomastigote. And this metacyclic trypomastigote within the salivary gland are the one that will be inoculated when this Glossina fly is taking another blood meal, and the life cycle will continue like that. So we shall see life cycle continuing when this Glossina fly, which has the metacyclic trypomastigotes within the salivary gland, is again taking a blood meal from man. So in summary, within the Glossina, we have seen the first step is when the Glossina is taking a blood meal from an infected human being having trypomastigotes. Then these trypomastigotes, the second is they move to the midgut and they undergo what we call binary fission. They multiply and form what we call procyclic trypomastigotes. So these ones which have multiplied in the midgut, we call them procyclic trypomastigotes. Then these procyclic trypomastigotes within the midgut of the Glossina, as they are being transported to the salivary gland, they metamorphose into the epimastigotes, and these epimastigotes within the salivary gland, they remetamorphose, or they are transformed into again short, slender metacyclic trypomastigotes, which is the infective stage. And when the Glossina is taking another blood meal, it will inoculate them, and the life cycle will continue. So this is the life cycle of trypanosomiasis. So after looking at the life cycle, we are ending this video by looking at what we call the pathogenesis and the clinical features. So under pathogenesis and clinical features, as we have already talked about them, pathogenesis and clinical features. How do you know that someone has sleeping sickness? We have seen it is categorized into two stages, whereby stage 1, we have stage 1 and stage 2. And within stage 1, in the first week, we have seen manifestation of chancre. And we have said this chancre is fluid-filled, red in color and fluid-filled. So this one manifests in 1 week. Then we see even as they move in the blood, they can cause what we call anemia. But we have seen invading the lymph nodes, resulting into lymphadenopathy, swelling of the glands, whereby we have seen there is what we call winter bottom sign. And this winter bottom sign is seen in Gambians, which is characterized by the swelling of the posterior cervical glands, lymph nodes, that is within the neck region. Then there is another one which we call Clendo's sign. Clendo's sign. This is due to delayed pain. This is defined as delayed pain on exerting pressure. This is whereby when you touch on an individual, he feels much pain. That is what we are calling Clendo's sign, and is one of the stages or signs and symptoms of someone with the trypanosomiasis. That is Clendo's sign, then Winterbottom's sign. Then this was for Gambians, which is Winterbottom sign, but within Rhodesians, we see swelling of the lymph nodes in the submandibular region, in the armpits, and in the groin region. So as it continues, it invades the central nervous system, and by the time it invades the central nervous system, that is in stage 2. And it is in stage 2 whereby the trypomastigote reaches the central nervous system, leading to the signs like confusion, then day sleeping, then insomnia at night. These are the signs when these trypomastigotes have reached into the central nervous system. So this day sleeping, that's why we call it sleeping sickness, whereby someone all the day they can be asleep. There is confusion, there is insomnia at night, where that is the disturbance of sleep, and at the same time there is still Caliendo's side, that is pain on exertion or on applying pressure. So these are some of the things we can talk about under clinical features, how you can know that someone has, and if it is not treated, it can result into coma and death. And 100% of patients in stage 2, they normally die if not treated. And one of the treatment we can use is suramine or pentadamide. Those are one of the drugs we can use, like suramine, to treat this infection. So this is what we can discuss with you in this session, where we have looked at the causes, the location, the vector, life cycle both in man and in the Glossina, and some of the signs and symptoms, how you can know that someone has sleeping sickness. Thank you so much for learning with us. May the good Lord bless you.